Now let's look at case control studies, which are relatively larger in scale than case series and involves two groups of participants. A case control study compares the exposure histories of people with and without a particular disease in order to identify likely risk factors for the disease. The primary study question is, do cases and controls have different exposure histories? For example, do infants born with microcephaly versus healthy infants have different virus exposures in utero? This approach is used when the disease is relatively uncommon and the risk factors are relatively unknown. Here's how it works. Cases are selected for inclusion in the study based on their disease status. Those with the disease are cases, and those without are controls. The two groups of participants are asked the same questions about their exposure histories, and elements that differ in their reports are considered possible risk factors for the disease. Case control studies require a sizable number of cases, so it's important to identify a source for your sampling. Possible sources are hospitals, specialty clinics, physicians' offices, public health agencies, disease registries, and disease support groups. All cases must have the same disease, disability, or other health-related condition, so you must be really clear on the specific characteristics of your target population. To find controls may be even more tricky than finding cases, because they must not have the case's disease, but also be otherwise similar enough to the cases to rule out contributions from other factors. For example, you cannot have mostly male cases and mostly female controls, because then you wouldn't be able to determine whether it's the exposure history that's leading to the disease or whether it's sex or gender. When conducting a case control study, it is first of all important to confirm that your cases are indeed cases and your controls are indeed controls. Thus, screening instruments like questionnaires, interviews, or medical record review guides must be designed to determine your participant's status at the beginning of the study. Another important consideration is the potential for recall bias, which occurs when cases and controls systematically have different memories of the past. For example, cases may be searching for answers to questions about why they have become ill, and as a result, they may have more vivid memories of, say, risky behaviors they undertook, strange foods they ate, or other circumstantial events that are not uncommon for everybody. Controls may not have paid as much attention to these events, or may have less vivid memories about them. The most tricky thing about recall bias is that you will not really know whether or not it's happening, so results must be interpreted with caution. Questions that you ask the participants should also be carefully phrased so they are not leading or suggestive. So, for example, instead of asking, "Have you had sexual contact with many different partners you didn't know well?" you should instead ask, "How many different sexual partners have you had? What was the nature and length of your relationship with each?" To better understand how case series studies work, you will read an article about Zika exposure histories by Cal Ormeau and colleagues published in 2016. The assessment will probe your understanding of this study's methods and findings.